to the implantable kidney technology and kidney on chip technology. And tonight we will just finalize the course related to this particular technology. The last two lections might be sound not connected to each other, but actually we discussed that digital twin is a potential technology, is a technology that can be potentially applied in the development of implantable artificial kidneys. And speaking of the medical systems and the medicine as a whole, there is a very active movement related to the incorporation of the digital twins and the AI technologies into the medicine, because especially when we talk about the population, when we evaluate the development of some disease within the population, when we evaluate the specific epidemiology, usually artificial intelligence and the neural and the computer science is very essential to provide additional tools for the doctors and for the medics to evaluate the complexity of the issue, the epidemiology, the way how this particular epidemics will evolve, etc., and so on. So in case of personalized medicine, it's also a very important issue, because we need to acquire the data from the patients online. And in case of the implantable technology, usually there is little opportunity for a patient to visit a doctor on a daily basis. That means that there should be considered an option of telemedicine. That means that the doctor can observe the state of the patient without the necessity to visit a doctor, and in order to evaluate the functionality of apparatus. It's also important to have an opportunity to observe the status and the current stage of the implantable technology without actually forcing patient to visit a doctor. And perhaps I will have to make a few qualifications, like do you remember the context of why we were discussing the digital twin application, and particularly implantable artificial kidney technology? Yeah, that's the, if someone has an answer. Yeah, it's like, yeah, it might be a little bit confusing, because we were discussing this issue a few days ago and in a very broad terms. So we were just grasping of the idea of why the digital twin technology could be a useful application for such technology as implantable artificial kidney. And it does not matter if we're talking about the bioartificial kidney or a total artificial kidney. At some stages, we have to observe and we have to predict the development of the product during its life cycle. And we actually discussed a very critical issue in terms of any life cycle of any medical technology, especially this technology that has to be used for therapy. Specifically, in our case, it's renal replacement therapy. Yeah, we were talking about the animal trials, and I would like to just correct myself in some specific aspects. Like I had during the election course, perhaps I did not find an appropriate word, and I said that in ethical reasons, doctors usually kill an animal after the trials. It's actually they euthanize it. So basically, what is the main problem with animal testings in case of the implantable artificial kidney technology? There are two main points of concern that I have to emphasize during this course of lecture, and considering that we have some extra time, I believe I have a privilege to to perhaps explain my point on that issue. So the main points of concern is basically the ethical reason and the expensiveness of the animal trials. Well, the ethical reason is pretty much understandable issue. For instance, in many countries, you need a specific document or specific decision from a ministry that permits the conductance of the animal trials, and usually those documents, they have a list of requirements that have to be met during the animal trials. So the animal does not have to suffer during the procedure, or at least the doctors and the medical personnel or the personnel of vivarium, they have to find the opportunities to decrease the pain and the suffering of the animal that they will experience during the procedure. So there should be no like additional trials outside those trials that have to be permitted within this document. And one of the major reasons is the idea that since we have to decrease the amount of suffering of the animal, we also have to take into consideration that if we perform some sort of a medical procedure that actually provokes some irreversible change in the organism or some irreversible trauma that can lead to lethal causes, we are not allowed to let this animal suffer after the animal trial. So the doctors actually have to euthanize the animal to relieve it from suffering. So, and of course, the discourse of the animal trials is a very, very loud topic, especially in the context when we talk about the accuracy of some animal trials, especially when it goes for the drug trials. For instance, the antibody treatment TGN 1412 that took place, if I recall correctly, in the Great Britain in 2006. So basically, if we talk about the drug testing, there can be a very, very nasty, sorry for my language, complications, such as if we test a drug on some specific animal, for instance, apes or monkeys who are resistant to some particular drug treatment. And we acquire a data that provides us the information that this particular treatment can be safe for a human. It's not always the case. In case of the humans, they can have the different immune response to the same drug. And despite the fact that there is like the first notion that we and, for instance, chimpanzees are very close relatives, and at evolutionary standpoint, that means that we have to have some sort of a similar immune response to the same drug treatment. And the biggest concern was the animal trials at that point, that they do not necessarily provide always inaccurate information about some specific issues. And that means that we can make a false conclusion that can lead to lethal consequences for the volunteers who will be treated by the same method. So one thing is the ethical issue, like we have to basically hurt or kill an animal in order to test something. And another issue that lies here is basically the issue of accuracy. So how do we exactly know that specific treatment will not hurt humans, for instance? And it's more in ethical standpoint, an even more critical issue, because if we kill a human person, then that's a murder. We made we made a mistake in our scientific conclusion, and this false conclusion led to a lethal cause for a human test subject, or a human volunteer rather, not test subject. So yeah, that's another one point of concern. It's an ethical issue in many aspects. It's we have to conduct these animal trials on animal, and we sometimes have issues with the accuracy of the animal trials. And another issue is, of course, a financial issue. It's perhaps not as critical as the ethical issue, but nevertheless, usually the animal trials are very expensive procedure that requires a specific vivarium where there are created specific circumstances for the animal growth. And considering what type of equipment or what type of procedure you're about to test, you need to choose a specific animal module. So one thing is when, for instance, you need to experiment with peritoneal dialysis solution, and you have an opportunity to test it on small animal subjects like mice or rats. From my practice, we actually performed the no, not I, because I'm an engineer, and another ethical concern here is that the engineer himself cannot conduct any form of medical trials or any form of animal trials or whatsoever. So we is a very broad term. So we actually collaborated with the Sechenov Institute in that course, and we conducted the experiments related to the influence of the spent dialysate solution that went through the dialysate regeneration unit. Perhaps the audience can tell me why exactly we need a dialysate regeneration unit and for what particular apparatus. Any idea? That was probably lecture 4, so I understand the confusion. It was like a few days ago, but take your time. Basically, it's an attempt to actually create another apparatus. Like we right now we're talking about the wearable artificial kidney technology, implantable artificial kidney technology, and on the other hand, we can actually adapt another type of technology, and this type of technology requires a dialysate regeneration unit as one of the most critical parts of this particular equipment. We were talking about wearable artificial kidneys, and we were talking in the context of the conducting the hemodialysis and peritoneal dialysis in a way that those two procedures could be wearable in quotation. So we could increase the social mobility by the patient by making a wearable device for hemodialysis or peritoneal dialysis. And the main concern, what actually prevents us to make a wearable device if we do not have a dialysate regeneration unit? What do we require for the convenient, the conventional method of renal replacement therapy, whether it's a hemodialysis or peritoneal dialysis and their modalities? I'm sorry. Yeah. No, I'm not talking about the digital twin technology right now. I'm talking about more technical part. Yeah, that's a correct answer. So in case of hemodialysis, we have to consume a very huge amount of dialysis fluid, and peritoneal dialysis usually requires a very frequent exchange of the peritoneal solution. And for that reason, we need a dialysate regeneration unit if we consider the option to create a wearable artificial kidney technology. So coming back to the animal trials, the main concern if we apply some methods to regenerate this dialysate fluid, that means we can use a specific sorbent method or any type of urea selective method like enzymatic method, etc., and so on. We have to take into consideration that this particular solution that we tested can affect the physiological functions of the human abdominal cavity or peritoneum, etc., or the molecular blood composition. And one thing is when we have to test, for instance, this specific issue. So we have the spent solution that we circulated through some specific dialysate regeneration fluid, and we choose the red module, for instance, to test the effect of this dialysate fluid on the state of the mice or rats. That's basically the concern that was risen in a Q&A session after the yesterday's lecture. And another thing is when we actually test the entire equipment, it could be an implantable artificial kidney or wearable artificial kidney. And for that reason, we need a big animal module. For instance, for variable artificial kidneys, or when we test the same peritoneal dialysis approach, we cannot test an equipment that weighs about 2 to 3 kilograms on a small rat module, because we need to apply at least 1 to 2 liters of peritoneal solution in the peritoneal cavity. That means that we need to actually test this particular apparatus on a big animal subject. Usually pigs are used because they have very, in an anatomical sense, they have a peritoneal cavity that is similar in a physiological sense to a human peritoneal cavity. So what is the issue here? Usually it's, well, aside of the ethical issues that we already discussed, it's usually an economic issue, because big animal module requires a lot of nutrition. It requires a very huge place where it can actually live in, so a bigger vivarium room. And in specific cases, the nutritionist needs to make sure that there will be no additional fat grow in the peritoneal cavity, so they have to moderate the diet of the animal to make sure that the catheter will not be contaminated with the fat tissues, etc. So usually it's a very time-consuming and very expensive procedure, and at the same time, it's not always a successful thing. So we, on the lection 6, when we were talking about digital twins, returning to the subject that we're going to discuss tonight, we considered the option that digital twin, as was mentioned correctly by your colleague, could be potentially used as the alternative at some point, the alternative to the animal trials. Of course, it cannot change, it cannot replace completely animal trials, because at some point we need to make sure that the apparatus or a drug or any type of the medical equipment that we develop is actually safe for a human. So we cannot escape the necessity of the animal trials. But at some point and at some stages of development, we can actually decrease the expenses, and we can decrease the amount of animals that we require to perform some basic animal trials in terms of functionality of the apparatus within the animal module. As it was mentioned by one of your colleagues on the lection 6 related to the digital twin, of course, it's a big concern how exactly we acquire these digital twins, because digital twins is basically a replica of the physical counterpart. That means that we have to, at very least, observe and collect data from the biological object, which is basically a very time-consuming part of itself, because if I recall correctly, when there was a research of the neural system of the fly, and there was an attempt to, there was actually an attempt to create the digital twin of this particular nerve system. It took decades to actually collect all sufficient data to replicate the digital copy of the physical neural system of the fly. So if we're talking, and that's just a one particular system of a fly and a relatively simple organism, if I can call it that way. So when we're talking about the organism as the collection, like the summation of the systems, like the nerve system, the blood filtration system, lung system, the heart cardiovascular system, etc., and so on, it's even a more challenging task, because we have to actually connect those systems to each other, and we have to recreate the hierarchy of those systems within the digital twin, and we have to achieve the fidelity and the accuracy of digital twin. So if replicating the digital twin of the relatively simple nerve system of a fly is such a challenging task, then replicating an entire animal module would be a challenging, even a more challenging task in that regard. So in that case, there should be some compromises from my standpoint of view, from my point of view, because at very least when we discuss the digital twin is not always a digital copy of the entire part or the entire system. It could be a digital twin of some specific component or some specific asset that can be a part of a system or a part of an organism, for instance. So if there is an opportunity to imitate and make a digital duplicate or a digital copy, digital twin of the cardiovascular system, then probably in terms of the animal trials, it could be considered to develop, for instance, a digital twin of the cardiovascular system or the peritoneal or of animal module that we want to test, and we combine this digital twin basically with the information or the module or the digital twin of the apparatus that we want to test. Again, it's a very time-consuming process because right now, if we talk about the alternatives for the animal trials, again, that goes from my perspective, what I discussed with specialists on that point. So we have the animal trials, and we discussed that there are multiple issues with that problem. First and foremost, it's ethical issue, economic issue, and there is always a probability that a mistake can be made, like in a drug test, for instance. So what is proposed is the biotechnology. And some people consider the digital twin approach. So the biotechnology is very prominent attempt to recreate the animal trial without using the real animal tissue, because basically we can create a sort of a bioreactor that provides an opportunity to grow some specific cultures of cells that we want to test in case of a human body without actually making this test on the human subject himself. And basically, there are some attempts to recreate the entire system of the human organism within one bioreactor. It's basically another time-consuming and very complicated technical problem, but nevertheless, such attempts actually exist. And digital twin, what is the advantage of digital twin in this particular case is that we do not require a biopsy or any biotechnology here, because biotechnology itself is also a very complicated, very sophisticated, and very expensive technology. So in that case, two possibilities exist, and they both have advantages and disadvantages, because digital twin is also can be a very time-consuming issue, especially when we talk about very complicated systems. But nevertheless, such possibility could be possible in biomedical technologies. So returning to the AI in the healthcare and the digital twin application, just like I mentioned right at the beginning of this lecture, well, I'm not myself an AI specialist, so I will just bring a very quick overlook on this technology. Basically, there is a trend of incorporation of AI technology in the healthcare. So we discussed the outbreak prediction. So speaking of, for instance, the chronic kidney disease, it could be very handful in the prediction of the development of the chronic kidney disease spread and development. And basically, the AI integration would help to predict what countries will suffer the bigger economic and healthcare issues due to increase of the amount of the patients with different kidney conditions, including the chronic kidney condition and the terminal kidney failure. So the diagnosis of diseases that goes to the personalized medicine. So it's actually a very handful tool to for a doctor to make a diagnostic decisions. But like in every technology, there is one small complication that has to be taken into consideration. So let's assume that the doctor has an AI that helps out to actually predict or to diagnose some specific disease, and it provides some particular data about the patient and what particular issue can we emphasize here in terms of ethical problem. Well, it might not be obvious, but in that case, we actually say that AI technology is not a decision-making tool because there is always an opportunity, a possibility that there could be some malfunction or some kind of error within the algorithm that can provide a distorted data. So the last decision is made by a doctor. So in a legal case, you cannot say that the decision, the wrong decision was made because AI told me so. Basically, AI is not a person. It's just a very complicated but still a tool that actually provides additional data about a specific issue. And when we talk about for instance, the diagnostics or any type of healthcare that relates to, for instance, detection of the cancer cells, it's actually up to the doctor or the specialist to make a final decision, while the AI is more like an assistant tool that will tell a doctor, please take a look at this particular sample. There can be something in there. So it's basically an assisting tool that helps a doctor to emphasize some specific issues that have to be addressed. But nevertheless, the doctor is makes the final call in any decision. So in terms of legality, AI is not a person. AI is just a tool. But probably for some people who attend this course, it can be an obvious statement. Yeah. So continuing that, yeah, we just mentioned that clinical trials can be a good application for AI technology, specifically because we can integrate the AI technology in the digital twin. And when we talked about the digital twin in the Lection 6, we were actually talking about the bidirectional interaction between the digital twin and the physical counterpart, the physical twin. So in case of fidelity, we heavily require the integration of AI technology for digital twin application, because otherwise we will not achieve enough fidelity or enough robustness of the digital twin. And that means that this digital twin will not directly represent the physical copy or the physical counterpart. And one of the functions of digital twin is that we can affect the state of the digital twin by means of affecting the physical counterpart by changing the properties of the digital twin. So yeah, speaking of the AI in healthcare, there is a very broad integration of AI technologies in medical application right now. And basically, of course, when we're talking about the AI technology, we cannot just skip the digital twin part. So yeah, speaking of industries, like as we talked, there is a very huge application of digital twins in the medical application and industrial application and the scientific research. And why digital twin is essential here is because of that particular bidirectional feedback loop. So we acquire some data from the physical counterpart. We process the data acquired from this physical counterpart, and we make a feedback to the physical system to affect it through the digital twin. And the AI-driven enhancement is basically required to support the decisions that we make with the digital twin, and to provide the further data development and training of modules to actually enhance and and digital twin and make it more robust and more and increase the fidelity of the digital twin to the physical system that it copies. Yeah, this is just the another application of how this actually works. That's basically another form of describing the interaction between the physical entity, virtual entity, and the data exchange between this. What is important here, and I will source the National Academics of Science, Engineering, and Medicine Foundation research gaps and future direction for digital twins. So if you are very interested in the AI technology and AI application and digital twin, and if you're interested of what digital twin is and what particular applications can be used for digital twin technology, I strongly recommend you to address this book first because it provides a very detailed disclosure of what this technology is all about. It provides a very thorough explanation of what the feedback from the physical counterpart to digital part should look like, how it should operate. It actually covers very thoroughly the feedback between the digital twin to a physical counterpart and what particular issues we have to address to make sure that we acquire enough fidelity for that part. So basically, it's a very a must-have read. And basically, if you're interested in the application of the digital twin technology in medical application, including medical application, because what's good about this book is that it gives a very general information about technology in itself, but at the same time it provides a very good examples of how exactly this technology can be used in the drug testing, for instance, or how can it be used to evaluate the working condition of some biotechnical system. Returning to our particular course, we're talking the implantable kidney devices. And when we incorporate this implantable kidney into a human, into a patient, we actually start to work with the biotechnical system. So what does it exactly mean? That means that we have the biological system and we have a technical system that performs the renal replacement therapy. And in that case, we have to evaluate the essential parameters of both systems. And integration of this technology actually provides a better outlook on this part. So returning to the necessity of the AI technology, what we actually have in mind is the entire digital twin ecosystem. So it incorporates various types of phenomena and processes that take place here. So, of course, when we talk about the digital twin, we're talking about the close connection between the physical counterpart and the digital twin. And yeah, so basically, what would be the main difference between the, say, mathematical module of some specific object or some specific phenomena and the digital twin in this case? Yeah.
In the visual representation, what is the meaning of this visualization? What visualization?
The
Sorry.
and visualization.
What is the meaning of this? Is the physical counterpart correlated with this visualization in a virtual representation?
Well, if we have the digital representation of some physical counterpart, there are some applications when there can be visualization of the physical object. So, returning to the NASA experiment that they made the first digital twin of the apparatuses that they sent to space, they actually, for the purpose of the visualization, made a physical copy of the apparatus, and digital twin basically helped to imitate the work of this apparatus on the ground. And from my understanding, the visualization could be a visual representation of some technical processes or phenomena that take place in a physical counterpart. So visualization could be a plot or a number of the graphs and these visual representations of different phenomena or different, uh, I'm sorry, apparatus processes that take place within some asset or physical engine, for instance. So yeah, returning back to the main idea of this lecture, perhaps you can tell the core difference between a mathematical module and the digital twin. Hmm?
Mathematical model is based on first principles.
Hmm.
This other one is more like
Well, yeah, I would assume that in terms of the digital twin, we're talking about the fidelity of this particular system. Mathematical module is actually could be a more simplified or just a description of how a specific process can take place without actually direct connection of the mathematical module and the physical process that we observe. While the digital twin more like a uh, digital copy of the specific process or specific asset that we're talking about, and it basically has to be uh, imitating this process during in the time in some specific time scale, so we can predict how it will this process develop in the um, in the time scale, or we can evaluate the physical processes that take place there. But basically, due to the core difference here is the bidirectional um, feedback between the physical counterpart and the virtual representation. In case of mathematical module, we presented some sort of a mathematical calculation that provides us very essential data like the prediction of the process that will take place in the time scale, or some parameters that we can calculate with the help of the mathematical module. But at the same time, it does not have any feedback with the real system that we're describing. And the idea behind of digital twin is to create a digital representation that through the feedback will imitate the physical counterpart. So in some sense, it's a more uh, complicated technology that requires the integration of the AI, because in order to establish the and verify the accuracy of this feedback, we need to actually proceed with the machine learning that will help us to verify the accuracy and the robustness of uh, this bidirectional interaction. So it will require verification, validation, uncertainty, quantification, ethics, and security. Why exactly they mentioned, by the way, the ethics, for instance, and security?
I think digital twin will help these two processes. This physical counter to data. Firstly, data give by the physical counter to the digital twin, and then digital twin give the data. I think AI,
Yeah,
and AI just visualize all that means problems what will inside the kidney or what diseases.
yeah,
Then again he go back and to digital twin and go again. So this type of means will happen. I think so.
yeah. But we specifically talk about the ethic and security. So the authors decided to emphasize the attention on these specific issues as well. And what issue is ethic and security here? If we're talking about the medical application, perhaps someone has an idea. Yeah, exactly. When we collect the data from the biotechnical system, we actually interact with the patient as well, and we acquire some personal data that is cannot be disclosed within any medical institution. So when doctor collects this data, the security issue has to be the primal concern, one of the primal concerns for a doctor, because he cannot disclose or spread the information about the patient who suffers from chronic kidney disease condition. And if he acquires the data from multiple patients who go through the renal replacement therapy by means of the implantable artificial kidney technology or any type of technology that exploits the digital twin within. That means that this data has to be secured. There should be no data data corruption or data leakage, etc. And of course, it's an ethical issue because we need to take into consideration that the reliability of this system will not allow the data leakage of the leak of the personal data, because personal data actually includes not just for instance, the composition of blood or the condition of kidneys. It basically can include the personal information about the name, the date of birth, etc. Some very, very sensitive information that should be held secured. That's why the consideration of ethics and security of data is actually one of the main issues of the digital twin development. Of course, it's not a technical issue, but nevertheless, when you consider the integration of digital twin technology into the implantable artificial kidney, and when you consider the integration of AI technology to achieve the fidelity and robustness of the digital twin in the context of this system, you have to take into consideration that these issues are not the least that you should be concerned of. They first and foremost, one of the primary concerns that you have to take into consideration, because if your digital twin is not reliable and it provided the information to the third party, that would be a huge issue for the company that develops this particular product. So yeah, this is just a small representation of the interconnection between the machine learning and multi-scale modeling. There are main points of the connection between them. So they can be used separately and together. So when we're talking about the creation of digital twins, we can actually go from two main points of concern. So we, for instance, can start with the data collection, especially it's the empirical approaches could be considered, for instance, in such cases as the weather forecasting. So in terms of digital twin, it's possible to create the digital twin of the climate processes that take place around the world. And since it's a very complicated and very multifactorial process, there are many complications with starting with just mathematical models. So we have to collect a very huge amount of data to actually use this data to create the mathematical module from that. So we go from the empirical approach and we analyze the acquired data and we make the numerical module of the process that takes place in some specific system. And using that, we provide the analytics, and that provides the opportunity to make a decision making. There can be a different approach. So we create the mathematical module first that provides us the numerical module approach. This mathematical module provides us the more accurate work with the data, and that provides us the opportunity for decision making. So there are two approaches that we can use in a digital twin development, and they are not mutually exclusive. So in many cases, we have to actually use different points of connection to apply machine learning and the digital twin here. So in case of the disease development and in case of the natural processes and phenomena that take place in human organism, we can, for instance, go from the empirical approach that we collect some data, and on the basis of this data, we develop a better understanding of what this process actually is, and we provide a numerical approach of how exactly we can evaluate this process. And from that, we can go with the analytics and the decision making, or in case of some specific element digital twins, for instance, within the apparatus. We can start with the modeling. We can go then with the numerical modeling and the data collection and the decision making. So in terms of complicated digital twins, we have to basically combine these different approaches. And one way or another, we have to consider the machine learning and the AI integration for the robustness of this particular system. So the summarize of this lecture will be as follows. So we need the AI for the following roles within the digital twin. So it's AI optimization, both in regards of model creation and model updating, because again, we're talking about the system where there's bi-directional exchange of data between the physical counterpart and the digital twin. That means that if we have some model of the system that we imitate within the digital twin, we need to constantly update it accordingly to the physical counterpart. Otherwise, the fidelity of the digital twin will be in question. Well, generative modeling is very hot topic. Basically, it depends on the decision making that could be made in the digital twin. And basically, I think the generative modeling that they can basically can be used within this digital twin technology. And I would focus just the attention on the data analytics, the predictive analytics, and the decision making. So the AI will provide the robustness of the system by the analyzing the data that we acquire from the system. The predictive analytics actually provides us the opportunity to predict the development of the specific digital twin or the physical counterpart during the life cycle of this item or any product that we're talking about. And decision making, well, that's the in terms of the medical equipment. Of course, the decision making is usually goes for the doctor or the medical personnel. AI actually can provide a better outlook of what exactly happened and what could be made in terms of dealing with some issue that could be it could be happening during the exploitation of the device. So in that regard, I think that the AI technology could be used as the form of the assistant tool that the doctor can use for the further decision making, because in terms of the medical systems devices, usually we cannot rely on the AI decision making for the legal and ethical reasons. So the last word will be after the doctor who will make the final decision about the equipment exploitation. As just a short outlook on the advantages and disadvantages of this technology, it has to be said, of course, that no digital twin can operate without any AI technology or machine learning, but nevertheless, it could be considered that in order to achieve efficiency, the accuracy of predictive analytics and personalization, one way or another will require the integration of AI technology. And speaking of disadvantages, of course, it's a complexity, it's a data privacy that we discussed previously, and cost implication. Well, of course, any sophisticated technology will require some investment in order to achieve a necessary goal. So, considering that we have some additional time, the first thing that I want to ask you, if you have any questions about the current lection course, lection 11, do you have any questions? If you have any questions, I will be glad to answer them. just to emphasize your attention, since it's not my direct field of expertise, I strongly recommend you to go for this particular book because uh, I can cover the some topics of the digital twin application in the medical systems, the way how I understand it and how I see it. But nevertheless, if you want a better outlook, a more thorough explanation of the digital twin technology, basically, I think the first a good starting book is the book provided by National Academics of Science, Engineering, and Medicine for future direction for digital twins.
So in the next challenging slide,
One moment.
in a challenging slide,
Ah,
next, or next, next. So the meaning of personalization, what challenge, which type of challenge is personalization?
well, it's not like challenges of personalization. It's where the AI can be integrated. So if we talk about the personalized medicine, where we have to acquire some data for the patient and we have to analyze some specific or individual parameters of the patient, it's basically the application in telemedicine and the application in the personalized medicine. This is not listed as the disadvantage of the AI technology. It's listed as the one of the main fields of application. But yeah, if we talk about the personalization, we have to take into consideration the data privacy. So we talk about the challenges of the personalization. The establishment of the data privacy is the main concern here. So it's not more like a technical. It could be a technical challenge here because we have to develop the system that actually provides a robust data security of the patient. But it's the main concern here because the data lake is uh, very sensitive issue for the personalized medicine and for medicine as a whole. Yeah, I think we still have some time. So if you have some questions, just don't hesitate to ask. Uh, in the next lecture, I will cover some literature that you can address for the topic of implantable artificial kidney development. Of course, it's a very broad topic. So if you just, as you noticed, we covered in a very broad manner different approaches and different technologies that can be applied or should be applied in the artificial kidney development. It's a digital twin, it's AI integration, it's development of the MEMS technology, it's the system engineering. So it's a very, very broad topic that actually has the interconnection with different type of specialities and different types of the engineering fields that have to be considered in that regard. And of course, it's impossible to be a specialist in everything here. So my purpose in this course was just to provide the basic understanding of the complexity of this technology and why exactly we required different uh, engineering approaches like the model-based system engineering. Why we could require, for instance, the digital twin technology and how exactly it could help in the implantable artificial kidney development. Why digital twin requires the integration of the artificial intelligence technology. And of course, for the better understanding why exactly we need the implantable artificial kidney, it is a requirement to understand the kidney's functions, to understand the conventional dialysis methods, what advantages they have, what disadvantages they have, why exactly it's hard to achieve the social mobility of the patient in terms of the conventional dialysis methods. And I will try to cover this literature in the next lecture. That's just a small comment here. So considering that we will have the examination in the second part of the day, it's the 3 p.m. I think I will have a privilege perhaps to make an interaction with the audience, well, outside the topic of the artificial intelligence technology, if you don't mind. No, let's just start with the direct question related to the topic that we discussed. What potential applications can you describe for digital twin application in implantable artificial kidney technology? What potential applications for the digital twin technology can you see in the implantable artificial kidneys? Yeah, yeah, that's correct. So it's a forecasting of the state of the patient. It's the forecasting of the how apparatus work. It's the current evaluation of the state of the apparatus. So basically, it could be multiple uh, applications for the digital twin technology, etc. So at the election 4, if I recall correctly, we were talking about the variable artificial kidneys. And how do you see it? What is the core difference between the variable artificial kidneys and implantable artificial kidneys? Ah, we must end? Yeah. Ah, uh, ah, yeah, Professor Kosha Guha asked me to extend this lecture for 10 minutes, or is it permissible? Ah, you can stop me in 10 minutes if yeah, yeah. I did not switch off my microphone, okay? So, any suggestions? Uh,
No, I mean, we're out of schedule. We just extend it. All right.
No, just a few minutes and we'll stop then. Well, perhaps those questions we can actually cover during the next lection. And perhaps you have any questions for me? All right, then just a small summary of the next lection before we proceed and answering the question that I just raised. Well, the initial idea behind the implantable artificial kidney was actually the attempt to imitate the work of the nephron. So basically, we can consider a system that imitates the Bowman, the glomerular capsule and the proximal convoluted tubule. That's I have to make a small emphasis that it's not always the case for all implantable artificial kidney prototypes, because we will consider when we will talk about the total artificial kidney, implantable artificial kidney, we will consider a technology that actually utilizes the implantable hemodialysis approach. So when we're we were talking about the implantable artificial kidney technology, first and foremost, I emphasize the implantable artificial kidney technology is usually a dialysis-free technology. So we do not use any sort of artificial solution for the continuous blood purification. Well, that's a little bit a very broad generalization from me. So um, I have to fix that mistake by saying that speaking of the implantable kidney technologies, there are some um, varieties of the implantable artificial kidneys that utilize the hemodialysis approach by introducing the concentrate of the buffer solution and mix it with the spent dialysis solution within the system. We will actually watch the promotion video that explain this idea. But basically, if we talk about the general approach, the variable artificial kidneys, on a very broad generalization, are basically the continuation of the peritoneal dialysis or hemodialysis at some extent. So we introduce the dialysis regeneration unit that provides the continuous regeneration of the spent dialysis fluid, and that provides us the opportunity to reuse the spent dialysis fluid all over again without need to constantly exchange the spent dialysis solution. In terms of the implantable kidney, the general idea was basically to utilize the renal assistant device approach that, of course, was used firstly and foremost for the hemodialysis system. But the continuation of this idea was actually an attempt to imitate the nephron structure within the blood filtration apparatus. So basically, that's a small correction I wanted to make. Speaking of the implantable artificial kidney technologies, there are some apparatuses that try to implement the hemodialysis without the implantable system, and that's what we are going to address the next lecture. If you have no questions, or do you have any questions? Then I think we can proceed with the next lecture after this small tea break. Thank you.